There are several side effects that you might experience after surgery. These can include constipation, diarrhea, nausea, vomiting, dumping syndrome, and low blood sugar. It should be noted that although you may experience some of these, the majority of them are caused by lifestyle choices. These can be things you're drinking, things you're eating, or things you may be eating and drinking at the same time. The good news is that you can live almost symptom-free after surgery, as long as you are following the recommendations that we've provided for you. If you are unfamiliar with what dumping syndrome is, it is a reaction to consuming sugar or processed carbohydrates. Most people liken it to food poisoning, where you might find yourself running very quickly to the bathroom, shaking, sweating, and potentially vomiting at the same time. This will normally occur within 30 minutes to 1 hour after consuming one of those foods. Reactive hypoglycemia can also occur after surgery. This is also a reaction to eating sugar or processed carbohydrates. Sometimes, however, reactive hypoglycemia doesn't come on until a few years after you've had the surgery. This can lead people into a false sense of security. Symptoms of reactive hypoglycemia can be fatigue, shakiness, and sweating. They may occur at random times throughout the day. If this occurs to you, take a look at your diet and make sure that you are not eating anything with any sugar, any white flour, or processed foods. As part of having bariatric surgery, you will need to purchase protein supplements. As you may remember, there are a few different criteria that you need when looking at protein supplements and drinks. As a refresher, you're looking for something that has around 5 grams of total carbohydrate and 20 to 30 grams of protein. I recommend choosing a protein drink that has more protein, more towards around 30 grams. That's because it will make your life easier after surgery and you will need to consume fewer supplements. I also recommend having a combination of powders and pre-mixed drinks. Pre-mixed drinks will be extremely helpful for the first phase after surgery when you are drinking very slowly. This allows you to put your drink back into the refrigerator to keep it cold. Protein powders are a fantastic option to have on hand, especially unflavored protein powder. That's because it can be mixed into yogurt or baked into foods. However, the downside of protein powder is that after you mix it up, if it sits for a while, it starts to become a little more congealed. This may not be what you want first thing after surgery. That's why having a variety of choices will give you the best experience after surgery. After you have surgery, you will need to take specialty bariatric vitamins. These are not vitamins that are found in grocery stores or sold over the counter. They're typically only found online or at bariatric centers. It is extremely critical that you take the correct amount of vitamins and that they are bariatric formulated. Again, these cannot be regular over-the-counter vitamins. We also do not recommend taking items such as Flintstones or vitamin patches. We take our bariatric vitamins very seriously. That's because vitamin deficiencies can become life-altering. Certain vitamin deficiencies can cause things like nerve damage, fatigue, dizziness, weakness, permanent brain damage, paralysis, loss of muscle coordination, and impaired cognition. Some of these symptoms are irreversible once they occur. So even if we brought your vitamin levels back up to normal, the damage would be done. That's why we carefully choose our bariatric vitamins. We recommend using vitamins from a company called Bariatric Advantage. We choose them because they have the highest standard for quality, testing, and ensure that all of their products meet the recommended doses for bariatric patients.
Now that we're preparing our mindset
for surgery, I want to touch back on some of the complications that are more common with some of those metabolic procedures. Oftentimes, when you undergo a metabolic surgery, there's a lot of stress that comes up about being intubated, having anesthesia. There's a lot of fear around that. So now that we're at this point in your journey, surgery is just around the corner, or maybe you just had it. I just want to refresh your memory and your mind about what can happen after a sleeve gastrectomy. When we reduce the size of the stomach and you still have the pylorus intact, this is also what is possible in the duodenal switch and in the SADI, the single anastomosis duodenal interposition. It's a mouthful. That's why we abbreviate it SADI. So these operations are very similar on the stomach. The stomach size is reduced, but that muscle at the bottom of the stomach is left intact, which means that you need to really be mindful, there's that word again, and aware, there's that word again, in how you're eating and drinking so that you don't overfill your stomach at a speed in which it doesn't empty. So if we overfill our stomach for the capacity of what it can hold, it's going to reflux back up and you're going to get heartburn. Contrary to these operations contributing to the experience of heartburn, a lot of people have heartburn before they even come into surgery. And that might be because of the extra weight that they're carrying around the abdomen. I think a lot of women can relate. In pregnancy, as they're growing a baby inside of them, as the pregnancy progresses, heartburn gets worse and worse. The same thing is true when we have abdominal obesity. The pressure in the abdomen is actually greater than it is in the chest, which means that things can reflux up more easily. So maintaining a healthy body weight can actually help prevent reflux. I'm going to tell a story about Jim. Jim is a 65-year-old male who's lost 150 pounds and has maintained it for 5 years after sleeve gastrectomy. I walk into the office and I'm just excited to see him because he has maintained 150 pounds of weight loss after the surgery. And he tells me, "Doc, I haven't changed a thing." I'm like, "Jim, what are you talking about? You've maintained 150 pounds of weight loss. That is actually very exceptional. You have changed a lot." And he goes, "I still eat what I want." I'm like, "Oh, do tell." He's like, "I just eat half of what I used to." And I want to share that with you because after a sleeve gastrectomy, that's really what is possible. It really takes mindfulness, awareness, and that participation, that co-participation in recognizing what your portion sizes really should be to maintain your weight loss long term. Our intestinal bypass operations include gastric bypass, the SADI, and the duodenal switch. While these operations similarly bypass a portion of the upper intestine, they actually are a little bit different. The gastric bypass can have complications like marginal ulcers and intestinal blockages such as internal hernias. This is true for all of the intestinal bypassing operations. But what's unique about a gastric bypass is that the upper stomach pouch is so small, the stomach acid in the upper portion of the intestine that you eat into is reduced. Over time, what this does is this gives signals to the bacteria that live in your gut that changes the pH. So bacteria that normally grow and ferment in the colon start migrating higher and higher up in the small intestine. What can happen is people can experience bloating and abdominal pain after eating certain carbohydrates pretty early after a gastric bypass. The Art of Bariatric's antidote to SIBO, small intestinal bacterial overgrowth, is to consume fermented foods every day with every meal. By consuming fermented foods daily with every meal, you're bathing your digestive tract and your gut bacteria with friendly probiotics. Probiotic consumption in food form is actually preferred in a gastric bypass versus taking pills. You don't necessarily know when those capsules are going to break down and dissolve. So by taking a little bit of fermented food, such as kefir, natural Greek yogurts, sauerkraut, kimchi, and even miso, these are traditional foods that have been fermented in many cultures all over the world for a very long time. And studies show that when we take fermented foods as part of our diet, we have better colon health, better mental health, and better well-being. So my best advice to you is, if you've had a gastric bypass, do take care of this part of yourself and start consuming fermented foods daily so that you can prevent bloating, abdominal pain, and this condition of SIBO so that you have the best long-term results.